How did bone marrow analysis for leukemia become so advanced? Imagine a journey that spans over 150 years, transforming how we understand and diagnose leukemia through bone marrow analysis. It all started in the mid-1800s when scientists first recognized that blood cells originate in the bone marrow. In 1868, Franz Neumann identified the marrow as the source of blood cells and suggested that leukemia was a disease affecting this tissue. Soon after, in 1876, Mossler introduced the technique of bone marrow puncture, which involved using simple tools like wooden drills to aspirate marrow samples from patients suspected of having leukemia. This was a breakthrough because it allowed doctors to examine the marrow while the patient was alive, rather than relying only on post-mortem analysis. Around the same time, Paul Ehrlich developed staining techniques that made it possible to differentiate between types of leukemia based on cell appearance and staining properties. These early methods laid the foundation for classifying leukemia into different subtypes, such as myeloid and lymphoid leukemia, based on cellular features. As the 20th century progressed, improvements in biopsy techniques, staining methods, and microscopy made it easier to analyze marrow samples more precisely. Doctors could now distinguish between leukemia subtypes by observing the shape, size, and behavior of abnormal cells, like lymphoblasts in acute lymphoblastic leukemia or myeloblasts in acute myeloid leukemia. Laboratory tests also advanced during this time. White blood cell counts and detailed marrow histology helped identify the specific immature or abnormal cells infiltrating the marrow. These findings provided important clues about prognosis and helped guide treatment choices. Then, in the late 20th century, the field took a giant leap forward with the development of immunophenotyping and molecular diagnostics. Researchers discovered that certain cell surface markers, like CD20 on B cells, could be detected in marrow samples. They also identified genetic abnormalities, such as the Philadelphia chromosome in chronic myelogenous leukemia. These discoveries allowed for targeted therapies that specifically attack cancer cells based on their molecular features, like rituximab and imatinib. Bone marrow analysis evolved from simple morphological examination to include flow cytometry, cytogenetics, and molecular testing. These tools provided a detailed understanding of the disease, enabling precise diagnosis, risk assessment, and personalized treatment plans. Over time, biopsy procedures became safer and more standardized, with better needles and protocols reducing patient discomfort and risks. The creation of bone marrow registries and improved donor matching also expanded the role of marrow analysis in treatment, especially for stem cell and bone marrow transplants. Today, analyzing the bone marrow is a cornerstone in diagnosing and staging leukemia. It combines multiple techniques: morphology, immunophenotyping, cytogenetics, and molecular testing to give a complete picture of the disease. This integrated approach has significantly improved outcomes by enabling early detection, accurate classification, and monitoring of treatment response. It has also paved the way for targeted therapies and transplant strategies that are tailored to each patient's unique disease profile. In summary, the progress in bone marrow analysis for leukemia has been driven by early discoveries about the marrow's role, advances in staining and microscopy, the introduction of molecular and genetic testing, safer biopsy techniques, and ongoing research. All these developments have transformed leukemia from a disease once considered fatal into a condition that can often be effectively managed with personalized treatment. Remember, always consult healthcare professionals for individual diagnosis and treatment options, as each patient's situation is unique.